using at the moment?
So this is just chlorhexidine, which is an antiseptic. So it's like a sort of surgical prep solution. It removes all bacteria and any viruses. And, yeah. So make your face super numb.
Lidocaine.
It's a mixture of benzocaine and tetracaine, so it's a really strong one.
Is this the stuff you usually use for?
Yeah. So it's stronger than, for example, LMX and Emla and that sort of thing.
Okay.
But yeah, it's. In fact, no, it's lidocaine 23% and tetracaine 3.5%. So normally these things are about 6%, 5% lidocaine. This one's 23%. So if you leave it on for an hour, it's hopefully going to be super numb. So you're getting basically under the chin. What you want to do is get to the fat. So you get some fibrosis in the fat layer. So it tightens the whole jawline and exit. Yeah. So
good for happy faces.
yeah.
A popular choice for acne scarring.
Yeah, it is. Yeah. Particularly the resurfacing head, which is the 1mm head.
What depth do you go in for the acne scarring?
Acne scarring 1mm.
Okay.
So for skin tightening and stuff, you want to be a bit deeper, so you're getting into just the top part of the fat layer, ideally. So, but for resurfacing, it's more superficial the better. So that's cool. So you'll start to feel that just a bit numb very soon.
How does it feel?
A little bit tingly, but fine.
Okay.
Good.
Good.
Let's start here. Is okay?
Yeah, completely numb.
At any stage, if anybody has any questions, then just let me know. Is okay? This is 3mm, so penetrating quite deep into the dermis. Good. You just turn towards me a second. So other side, 3mm again. So I'm pressing quite hard, just so that you know that the needles are all going in, the skin's not tempting. And then two pulses on each. So I'm going to keep it on 2 millimeters for the cheek and under the eyes. So what we don't want to do in this area is go into the fat at all. So maintaining all of the volume there. So I'm just going to push down and treat under the eyes like this. So 1 pulse each time. I'm going to do a little bit in the forehead, slightly lower energy just because it is a bit more uncomfortable. So that's a 35. This is more for acne scarring. Yep.
David, we have a question from one of the viewers. What power are you using?
So I'm using 35 joules for the forehead, but I've been using 45 for the rest of the face. So relatively high energy. So it's very well tolerated. Yep. Okay. Done. Hi everyone, I'm Dr. David Jack. I'm here with Dr. Beata from Weybridge, and I'm going to do a second demonstration of Morpheus8, which is the latest fractional resurfacing device from Inmode. So Morpheus8 works using microneedles combined with radio frequency to penetrate to different depths in the skin, and you can treat different things with this. And for Beata, what we're going to do is mostly kind of concentrate on the lower jawline. I'll treat also her under eyes and her upper eyelids as well for lax skin. So she should notice over a course of about 3 to 6 months, slight lifting of the jawline, reduction in the crepiness of the skin under the neck, and also improvements in the upper and lower lids, and just a general improvement in the skin of her whole face. So I'm going to just demonstrate exactly how I would do a treatment. She's had numbing cream on for about an hour already. It's a very strong numbing cream, one called Receptura, which is 23% lidocaine with 3.5% tetracaine, which is more than enough to make this treatment very tolerable. If you've got any questions, then please just type in and we'll ask them either as we go along or at the end. Okay. Ready?
Ready.
Okay. So all of the codes are in our thing numbers. Joules. So 45 joules. Fixed mode, so the pins stay out and they're held out. And I'm using 1.5 pulse per second. I'll do 2 double stack, and I'm going to do 3 millimeters along the jawline. Yes. It's always overlapping, about 50 to 75%. Okay.
Yeah, I would wait for at least 2 weeks after having Botox or filler before doing anything. These sort of treatments. If you just turn towards me, that's great.
Another question from the viewers, David.
Yep.
I want to sharpen jawline and the scalp.
Yes, so that's the whole purpose of doing this treatment, is to improve the contour of the jawline and reduce the kind of sagginess of the lower parts of the fat pads.
And how for millimeters do you use in the face?
I would, it's slightly risky, but I mean it can be if you've got somebody that's got quite a lot of fat there. I would usually use 3 millimeters, but I mean you could, it depends on the individual patient. Always under the chin I would use 4 millimeters though. I'll show you that in a second. So I'm going to go to 4 millimeters, and then I'm going to triple stack this. So I'm going to do 3 pulses on each point. So this is penetrating right into the fat. This bit's a wee bit more sensitive. Well done. You're doing really well.
I've got another question. How much overlap do you use?
Usually use about 75, well, between 50 to 75% overlap of each area. So you're effectively getting a double pass of treatment. Good.
Someone's wondering, Beata, how does it feel?
Well, you feel it. It's prickly. When Dr. Jug did more than one pass, it was more intense. So it's not a treatment for faint-hearted. I would say clients would need a lot of counselling and understanding that it's normal to expect this kind of discomfort.
And single. You can do single or double pulses here. Okay. Nice to press. Just do a few on the leg.
Someone asking, can you please tell us the types of local anaesthetic that you use?
Sure. So I use one called Receptura, which is from a compounding pharmacy in Germany, which uses 23% lidocaine and 3.5% tetracaine, and it's compounded specially. You can order it in the UK from Health Exchange Pharmacy. And then, for example, if you're treating the lower face and neck, the alternative to the topical local anaesthetic is that you can do injections of local anaesthetic, tumescent injections, and that also works very well. And there's absolutely no pain whatsoever with that. So that's definitely an option too. Okay. I would sometimes do more passes on under the chin if there's a lot of fat. I would maybe do 2 passes under the chin and maybe just the kind of pocket here as well. But because of the overlap, you don't necessarily need to do that.
And chin area, 2 millimeter depth, and what energy for the chin?
The anterior surface of the chin, I've done 35 joules. This area I've done 45 joules, so under the chin 45. And it's just the chin tends to be a bit more sensitive, so I sometimes turn it down slightly. And then I'm just going to do lower lids, so pulling down here. So single pulses, 2 millimeters. Let's work our way along. Well done. And do a second pass here. Well done. Yes. Yes, well done. The same on the other side. White surgical scars, you'd maybe use, it depends on what the scar is like, so if you've got a very stretched scar, then I'd maybe use a combination of 3 to 4 millimeters and then 1 to 2 millimeters with the uncoated pins, and I'd probably use about 35 joules again.
David, I have a question. If you treat eye bag fat, what is your suggested depth?
So 3 millimeters for eye bag. If it's fat, if there's...
Any questions about downtime?
Downtime is usually about 3 to 5 days. With resurfacing, so uncoated pins, the downtime is usually about 5 to 7 days, I would say. For the coated pins, for kind of for skin tightening, usually about 3 to 5 days maximum is the amount of time with kind of a bit of redness, a bit of swelling. Skin feels a bit like chicken skin, and then usually after about 5 days that's completely settled.
Cheeks, 35 for energy, and 1 pass.
And 1 pass for cheeks, yeah. Almost done.
Another question regarding cheeks. You have deep scars on cheeks. Would you increase depth or would you go
You could maybe go up to about 3 millimeters if you were, I mean, if the scar is very deep and it's very fixed and things, but generally speaking, I think for scar resurfacing, I would say 2 millimeters is on the face. 2 millimeters if it's on an area where you don't want to lose fat from, is a good depth.
And this can be used on the body?
It can be used on the body, yeah. So on the body, I would always do 4 millimeters, and you can even quadruple stack it, so you're getting really high levels of energy for skin tightening. That is, and for scars, it would be the same. So 2 to 3 millimeters, and you can do higher energy on the body as well.
Would it work in cellulite?
It can possibly help tighten skin and cellulite. I'd say that there are other treatments that you can use in combination with Morpheus8 for cellulite, things like Body Tight can be used quite effectively, and also Body FX. Stretch the skin up like this, and then done. A couple of little pulses here. Done. Good. Almost done.
That's gone.
It's well done. Okay. That's us done with the whole face.
Whew.
Okay, let's give you a wee clean up there.
It's okay. I mean, I have sensitive skin, so
Yeah.
I expected lots of
Yeah.
redness and
Yeah.
swelling and some
Yeah.
bleeding.
So a couple of questions coming through, David. What would the parameter be for cellulite?
For cellulite, I would use quite high, probably about 45 joules. I'd use 4 millimeters, so you're penetrating deeply into the skin. If it's somewhere, for example, in the thighs or the buttocks or something, you want to be as deep as you can be. And yeah, use high energy and quadruple stack, so at least kind of four pulses on each site.
Okay. And how effective is this treatment for acne scarring?
It can be, particularly the uncoated pins. So the machine has an option of 1 millimeter uncoated pins. So you're getting a lot of surface heating with that and a lot of remodeling closer to the surface of the skin. So it can be as effective as things like Fraxel laser, for example.
So you've seen good results.
Yeah, yeah.
Parameters for the upper eyelid.
Upper eyelid, so I'd go quite low with upper lid, maybe 30 joules or below, 2 millimeters, and always you have to pull the upper eyelid skin so that you're actually pressing onto the orbital bone with the handpiece, so you're not actually pressing onto the eyeball itself. Yeah. Any other questions?
Yes. If we use body effects, how long should we wait before we use Morpheus8 for cellulite?
You can wait for maybe, I mean, you can even do it at the same time after doing body effects if you wanted to. There's no reason why not.
Great. And downtime in such a session that we've done today?
Downtime, this is coated pins. I've done quite high energy settings, so probably about between 3 to 5 days.
Okay.
Any questions from Aaron? Good. All right. Well done. Well done.